Sneuhan syndrome, Huntington disease, Wilson disease, and Sneuhan syndrome can also cause the complex dystonia. The complex dystonia also occurs due to the drug and tumor or due to infection. The drugs, that is chronic use of levodopa, chronic use can cause the dystonia. Neuroleptic drugs, other neuroleptic drugs can also cause the complex dystonia. Tumor, there is CNS tumor can also cause complex dystonia. Trauma can also cause the complex dystonia. The carbon monoxide and manganese, Mn, manganese denoted by Mn, manganese can also cause the complex dystonia. Lesion in the striatum thalamus also cause complex dystonia. Lesion in the striatum thalamus can also cause the complex dystonia. Infection also cause the complex dystonia. Now we will discuss the pathophysiology of dystonia. Pathophysiology of dystonia. The exact mechanism of the dystonia is unknown, but it is suggests that there is in dystonia there is the co-contracting of the agonists and antagonists at the same time. There is co-contraction of agonists for muscle and antagonists at same time. For example, the agonists initiate the movement of one movement that may be purposeful, and antagonists inhibit the movement that may be the purposeless. This is the normal mechanism. But in the dystonia, there is the co-contraction, the contraction of both the agonist and antagonists. So when we initiate the movement, agonist work, antagonist inhibit. So there is the pattern type of movement of not unpattern. This pattern type of movement is called dystonia, but this is due to the co-contraction of both agonists and antagonists at the same time. One want to start in action, other inhibited. For example, one start in action, other inhibited. This is called dystonia. So both agonists and antagonists work at the same time in the dystonia. An agonist and antagonist, one of these movements are not required. So there is derangement of motion occur. Derangement of motion occur. There is physiological principle of action selection, that is which part of the body will activate and how many bundles of the muscle are activated. So this principle is disturbed when there is dystonia. The physiological principle of action selection is disturbed. As a result of this is abnormal movement. Some movements are inhibited in the dystonia because of the antagonist action, and some are initiated because of the agonist action. Sometimes there is purposeless antagonist action in dystonia, and sometimes there is the agonist action in dystonia. Sometimes the antagonist action are purposeless, and sometimes the agonist action are purposeless, but they disturb the actual movement and the purposeful movement of the body. So this is called dystonia. The treatment for dystonia. Now we'll discuss the treatment for dystonia. The treatment. The treatment for dystonia is the levodopa. All the classes of the dystonia can be treated initially by the levodopa. The levodopa. Because the dystonia are mostly genetic. The levodopa is started as the initial dose of dystonia in childhood. Second is the anticholinesterase. Anticholinesterase. Anticholinesterase must be given at high doses. At high doses, anticholinesterase must be given. The example of anticholinesterase is trihexyphenidyl. Trihexyphenidyl must be given. The dose is 20 to 120 mg per day for children. The baclofen can also be given. There is toxicity of the baclofen, but we can give the baclofen. Baclofen can also be given to 20 to 120 mg. The baclofen block the beta receptor. Baclofen B से beta receptor. Nicotinic receptor A receptor or B receptor. They block the B receptor and prevent the purposeless action of the muscle. Tetrabenzene can also be given. Tetrabenzene can also be given. The starting dose is 12.5 mg. Then we will give 25 mg, then to 75 mg per day. The botulinum toxin can be given, can be injected to paralyze the specific muscle, but this is used for small muscle group. Small muscle group. There is a condition called dystonic storm or storm. Dystonic tufan. Dystonic storm. In the dystonic storm is an emergency condition in which there is renal failure and rhabdomyolysis occur. In this condition, renal failure and rhabdomyolysis and renal failure occur. We give in this condition diphenhydramine, anticholinergic diphenhydramine, baclofen, benzodiazepine, benzodiazepine, because the benzodiazepines, they block, they are GABAergic, GABA, they block the GABAergic pathway. So we give benzodiazepine, buprenorphine, anticholinergic, phenhydramine in the cases of dystonic stum. The dystonic stum, there is renal failure, rhabdomyolysis with dystonia. With dystonia, there is these features.